Hi, my name is Julie and I'm going to do my head to toe assessment. This is my patient Rebecca, and prior to coming in and changing her clothes, I had Rebecca empty her bladder. We did her vital signs, which included height and weight. And we also tested her vision. We used the Snelling chart for distance, and we used the Rosenbaum for near vision. So now we're going to start your head to toe assessment. And I'm going to start out by inspecting your face. So I'm looking at your skin for any discoloration, any moles. We're looking at symmetry, we're looking at the bones. Everything is normal. I'm also looking at hair distribution, texture, and that the color is all the way around without any abnormal spots. Next we're going to be looking at some of the cranial nerves, and so the first one that we're going to look at is the facial nerve. And so I'm going to have you repeat a few things that I do. The first one is to squeeze your eyes closed. Second, we're going to wrinkle our forehead. Good. We're going to puff out our cheeks, and we're going to smile. Good job. Next cranial nerve we're going to look at is the hypoglossal, and that involves the tongue. So I'm going to have you stick out the tongue, move it up and down, and to the side. Good. And then the last one is the trigeminal nerve, and that involves here. So we're going to have you clench your jaw. I'm going to look at the tone and tightness. And then I'm also going to test sensation. So I'm going to be feeling spots on your face. You just tell me if you do not feel any of them.
Okay.
Up here. Here. And good. All right. Next we're going to palpate the face. So we're going back to the joint. No popping, no clicking. And then next I'm going to look at your sinuses. So you tell me if there's any tenderness or fullness. I'm going to be doing the maxillary and the frontal.
That's good.
Good? All right. Next we're going to go to the eyes. So I'm going to be looking at your eyelids for any kind of moles, discoloration. Your eyelashes turn out. Your sclera is white. Conjunctiva is nice and pink. And then we're going to be palpating your lacrimal apparatus. Any tenderness there?
Nope.
No. Good. Next we're going to do a few exercises that cover the extraocular muscles. The first one is called a cover test. So I'm going to have you look at my nose, and I'm going to have you cover one eye. And then I'm going to have you take it down while still looking at my nose and cover the other eye. And this we're checking for strabismus, and there is none present. Then we're going to check your visual field. So I'm going to have you follow my fingers without moving your head, okay? So we start going right across, then we go up and down, and then we go up and down, that way. Good. Next we're going to be looking at your ears. So I'm going to be inspecting them for placement and looking at your auricles. No lesions, no moles, no abnormalities there. I'm going to do the whisper test. So what it involves is I'm going to go behind you and I'm going to whisper a word while you are going like this in this ear. I'm going to whisper a word in this ear, and I want you to repeat it back to me, okay? So how do you do that?
4.
Good. Then I will come around and we'll do the other ear.
6.
Good. And then these next two tests involve the tuning fork. So the first one we're going to do is called Weber. So I'm going to make the tuning fork vibrate, and I'm going to put it on the top of your head, and you let me know if you can hear it the same in both ears.
Sounds good.
The next one is the Rhine test. So I'm going to do the same thing. I'm going to make it vibrate, and I'm going to be placing it on your bone. When you no longer hear that noise, you let me know, okay?
Yep.
And then I move it to the front, and you tell me when it disappears.
There.
And then that is normal because your ear was twice as long almost as your bone, so that is good. Next we're moving to the nose. So I'm going to be looking for your septum to see whether it's deviated. We're going to check color, that your turbinates are not swollen, there's no redness. I'm going to hold your nose shut and you let me know patency wise if your nose is open enough you can breathe through that side. And that side, good. Next we're going to move to the mouth. So I'm going to be looking at your gums and your tongue. We're looking at color. Any cavities? No, the roof of your mouth, the top of your mouth. There. Uvula is midline, it's not separated, it's not deviated. Next we're looking at the teeth, so we're looking for alignment, any cavities, no, nothing there. Tongue color is good, mouth is moist and pink, so everything is normal. The vagus nerve is involved, so what I'm going to have you do while I'm looking at your uvula, I'm going to have you say ah, stick out your tongue and say ah. Very good, it stays midline. Next we're moving to the neck. So I'm going to be looking at symmetry, and I'm going to be inspecting skin color. We're going to be looking at no obvious nodules or masses, no jugular distension. I'm going to be looking at your trachea, and then I'm going to go behind you and I'm going to palpate your thyroid. So I'm going to have you swallow, and I'm going to have you swallow there. Next I'm going to listen to your arteries, carotid arteries, looking for bruits, and your thyroid. No bruits. Then next, what I'm going to have you do is we're going to do some movement in your neck. So I'm going to have you go side to side this way. And then this way. Good. And then I'm going to put my hands up here and I'm going to have you bring your shoulders up. Good. Next, we're going to look at lymph nodes. So I'm going to start with the preauricular, and I'm going to move to the postauricular. And I'm going to move to the occipital. From there I'm going to go posterior cervical and anterior cervical. And then I'm going back up to the submandibular and the submental. And then into the supraclavicular. Good. Next we're going to go to the upper extremities. So I'm looking at the arms, I'm looking for equal, I'm looking at skin for color, no abnormal moles, no scars. Skin capillary refill is good on both hands, and then we're going to look at pulses. So I'm going to do brachial first, and then radial, and then I'm going to do brachial and radial. Good. Now we're going to move to the back. So I'm going to be looking at the back for measurement, for symmetry. I'm also looking at the spine for straightness. I'm going to be palpating down here in your costovertebral angle, and it indicates if you have any kidney issues, so I want you to tell me if you feel any tenderness while I do this.
Okay.
Good?
Feels good.
All right. Next, we're moving on to the lungs. So the first thing I'm going to be doing is I'm going to be looking at her respiratory pattern. Next, I'm going to be putting my fingers and my hands around her chest to feel symmetry as far as the way that she's breathing in and out to make sure it's symmetrical movement. And then next, I'm going to be checking for tactile fremitus. So when you feel my hands on your back, I need you to say 99, okay?
99. 99. 99.
Good. Next we're going to be percussing, so I'm going to be tapping on your back, and you let me know, first of all, if there's any tenderness. I'm also checking for the noise. I'm also going to do over here. And come around to here. Okay, good. Next we're going to look at diaphragmatic excursion. So what I'm going to have you do is I'm going to have, when I tell you, I'm going to have you take a deep breath and I'm going to have you hold it for a short time, okay? All right, take a deep breath. I'm looking for the scapular line. I'm finding the lower border. Okay, now you can breathe normal a few times. So now what I need you to do is I need you to breathe in and exhale and hold it. And then using the mark where I put the first time, I look for the difference in sound from dullness to resonance, and as long as it's between 3 and 6 centimeters, then that is good. Next we're going to be listening to the lungs. So what I'm going to have you do is I'm going to have you put your arms, cross your arms in front of your chest. Good. And I'm going to listen in sequence. Take a deep breath, please. I'm also going to listen to the lateral, to the side. Breathing sounds are clear bilaterally. So now I'm going to be looking at the chest. So once again, I'm looking at the skin, I'm looking at her breathing pattern, how she's doing. Your respirations are normal, there's no heaving, pulsation, or using accessory muscles. Next, I'm going to listen to the heart. So we go from the aortic to the pulmonic, to the herb, to the tricuspid, and to the mitral. This regular rhythm. Good. Next, I'm going to have you lay back. So for you to come to this side. The first thing I'm going to have you do is I'm going to have you put your arm above your head. I'm going to be looking for your infraclavicular and your axillary lymph nodes. And then I'll have you do the other arm. Good. You put them down to your side. And then I'm going to palpate the precordium. So I'm looking for any thrills or heaviness or... So I'm going to put one hand at the apex. And then I'm going to put it at the sternal border. And then at the base. No pulsations, no heaviness. Now we're going to move to the abdomen. So first I'm going to lift this up. I'm just going to be expecting color. Once again, no scars. The umbilicus is midline. You have no discoloration or anything like that. No signs of hernia. Umbilicus is central. And then I'm going to listen, auscultate all 4 quadrants. Vowel sounds are present in all 4 quadrants. And then I'm going to turn and use the bell to listen to the arteries in the stomach. And we start out with the aortic. We move to the renal, to the iliac, and to the femoral. Good. Now I'm going to be looking for the liver. So we're going to be palpating and percussing for the liver. I'm going to be using the mid-clavicular line. You hear the dullness. And we do it the same in the mid-sternal. we find it there. And then we use the left side for the spleen. You hear the dullness there. Now we're moving on to light palpitation. So I'm just going to be pushing lightly. And there's some right here. Looking for any abnormalities, any tenderness?
Nope.
No. Alright. And then we're going to move on to deeper palpitation. So I'm going to go to the right costal margin. And I'm going to be looking for the liver. And then I'm moving to the left side to look for the spleen. And then I'm going to pull over to look for your kidneys. Good. I'm going to be able to... Good. And pull that out. Next we're going to go to inspecting the legs. So we're looking at skin color once again, any kinds of scars. She does have a scar here on her knee that we're noting. Color, temperature is good, there's no edema. We're going to test for pulses. So I'm going to be looking at the pedal pulses. Then I'm moving to the posterior tibial. And then I'm moving up to the popliteal. And they are all normal. Lastly, we're going to do your musculoskeletal, your muscles. So this is the fun one where we get to use the hammer.
Oh yeah, let's do it.
So first we're going to test your brachial reflex. So I'm going to be holding your arms. And we're going to go about 2 inches above the wrist. And we're going to note that your hand jumps when I hit it. I'm going to come around. I'm going to do the same thing with this arm. Good. Next we're going to move to the knee. So we're going to go right at the base here. Good. Good. And the last one we have is the feet. So we're going to leave your legs hanging. I'm going to hold you at the heel, and I'm going to tap on your Achilles tendon. And that is good. That is good. And lastly, we just have a few exercises that we're going to do, checking your movement. So the first one is that we are going to, I'm going to have you push against my hands. Good. And then I'm going to have you pull. Good. Then I'm going to have you, once again, shrug your shoulders. Good. And then I'm going to have you lift your arms above your head and straight out. Bring them forward. And then one at a time, take them back behind your head. Good. And lastly, I'm going to be checking your lumbar spine. So I'm going to have you stand down on the floor. So what I'm going to have you do is I'm going to have you bend at the waist as long as it's comfortable. Looking at your muscles here in your spine. Good. That's good. You can come back. And then I'm going to have you bend backwards as far as you can. Good. And then turn side to side. Great job. So this concludes our exam. It was nice meeting you. Thank you very much.